Time for the KBOI Medical Moment, which is brought to you by Regence Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regence. Dr. Bramwell, good morning.
Morning, Chris and Paul J.
Doctor, our doctors and other health pros remind us all the time how important it is to pay attention to our blood pressure because of its connection to heart health. But now we're being told we better keep our numbers at top of mind for yet another reason.
Yeah, that's true, particularly when we reach middle age, which I have. Research published in the European Heart Journal found elevated blood pressure at age 50 is linked to an increased risk for dementia in our later years.
So at what number do the researchers say we need to pay attention?
So these studies say that a systolic blood pressure, which is the first number, as low as 130 at age 50, was independently associated with a 38% increased risk of dementia. It's yet another important reason to pay attention to our blood pressure numbers and to eat well, exercise, get enough sleep, and to take our medication if our doctors recommend it, even if you feel fine.
You just mentioned getting enough sleep. From time to time, it seems like, including last night, it seems like we all have nights of tossing and turning instead of uninterrupted rest. Is that a big deal?
Well, it certainly matters. Both the quality and the quantity of our sleep matters, regardless of our age. There are times when all of us, like you said, Paul J., last night, where you couldn't sleep or drift off nicely to and stay asleep. Doctors with the University of Pennsylvania Perelman School of Medicine suggest that 1 in 4 of us experience acute insomnia, which is defined as difficulty falling asleep or staying asleep 3 nights or more per week or between 2 weeks and 3 months.
Doctor, were any simple solutions offered to help us cope with these periodic bouts of sleeplessness?
Yeah, they have a couple of recommendations. I'd categorize these or call these things just sleep hygiene recommendations. They offer 3 bits of advice. 1, maintain a regular bedtime and a regular wake-up time. 2, don't look at the clock if you happen to wake up in the middle of the night. It creates a negative thought pattern that can be disruptive. And 3, keep technology out of the bedroom. Cell phones come to mind.
When I wake up in the middle of the night, the first thing I do is look at the time on my cell phone.
Right. And then you start calculating, how many hours do I have left to sleep? Oh, no.
Exactly. Finally, those of us who frequently called in to do dish drying duty in the kitchen might have a new reason to throw in the towel before we even start. What's that all about?
Yeah, I don't want to give my teenage daughters any ideas, but a new study presented at the annual meeting of the American Society for Microbiology in Atlanta revealed that of 100 kitchen towels that had been used for a month, roughly half of these towels carried pathogens that could lead to food poisoning.
So then do we need to place biohazard labels on our kitchen towels?
I think we just need to be smarter about replacing them. I'm having a hard time believing that a kitchen towel made it a month, but anyway. The best advice from the USDA and from others is to change our kitchen towels daily, especially if we know they've been used to sop up meat drippings. Routinely, these towels should be machine washed in hot water with detergent and bleach if white, or if colored, laundered with peroxide-containing detergent made for sanitizing. With a fresh, clean towel in hand, everyone in the Treasure Valley can still help with kitchen cleanup duty with a clear conscience.
Well, Dr. Bramwell, we thank you for your time on KBOI, as usual, this morning.
Thanks, guys. Have a good day.
Thanks, Doc.
It's the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regence.
Better life.